Over 280 million people suffer from depression worldwide, and millions take antidepressants like Prozac daily. But what if a natural spice could ease both depression and anxiety without the side effects? Could saffron be the natural alternative we've been overlooking? Saffron, known as the golden spice, has been used for centuries in traditional medicine and cuisine, prized not only for its rich color and aroma, but also for its healing properties. But in recent years, scientists have begun to uncover something remarkable. Saffron may actually support emotional well-being and reduce symptoms of depression. As mental health continues to be a global concern, researchers are looking beyond pharmaceuticals to explore natural, accessible options, and saffron is leading that conversation. Conventional antidepressants can be effective for many, but they come with significant challenges. Side effects like weight gain, fatigue, insomnia, and sexual dysfunction can severely impact quality of life. For some, the effects take weeks to kick in, if at all. Others struggle with finding the right dosage, dependency, stigma, or long-term side effects. Understandably, many are looking for alternatives or complementary options that are both effective and easier on the body. So how does saffron work? This vibrant spice contains powerful compounds like crocin and saffronol, which are believed to influence serotonin levels in the brain, the same neurotransmitter targeted by most antidepressants. One double-blind randomized study published in 2014 in the Journal of Affective Disorders compared 30 milligrams of saffron extract daily to 20 milligrams of fluoxetine, Prozac, in patients with major depressive disorder. After 6 weeks, both groups showed similar improvements in mood, but the saffron group reported fewer side effects. Researchers believe saffron helps regulate neurotransmitters, reduce inflammation, and combat oxidative stress, all of which contribute to emotional balance. A meta-analysis of 6 randomized controlled trials concluded that saffron is not only effective in alleviating depression symptoms, but is also well tolerated by most individuals. These results aren't isolated. Across multiple studies, saffron not only lifted mood, but also reduced anxiety levels. While it's not a one-size-fits-all solution, the growing body of research paints a hopeful picture of what natural medicine can offer. Most clinical trials report that saffron causes fewer and milder side effects than conventional antidepressants. For example, in studies comparing saffron to fluoxetine, Prozac, participants in the saffron group reported significantly fewer issues with sexual dysfunction, insomnia, and fatigue, some of the most common complaints with SSRIs. However, some users may still experience minor side effects, including dry mouth, dizziness, nausea, headache, and drowsiness. These effects are typically mild and temporary. That said, higher doses of saffron, especially over 5 grams per day, can be toxic and may cause serious side effects like vomiting, bleeding, or changes in heart rate. But these doses are far above what's used therapeutically. Saffron is generally considered safe and well tolerated when used in standard doses, around 30 milligrams per day for mood support. It's still important to understand that natural doesn't mean completely risk-free. Some contraindications and drug interactions of saffron include pregnancy. Saffron should be avoided by those who are pregnant, as it may stimulate uterine contractions and could potentially increase the risk of miscarriage. It's best avoided unless approved by a healthcare provider. Bipolar disorder. Saffron is generally not recommended for individuals with bipolar disorder due to its potential to trigger mood swings and excitability. It may exacerbate manic or hypomanic episodes. Saffron's effects on bipolar disorder are not well understood and are potentially concerning. Low blood pressure, hypotension. Saffron may slightly lower blood pressure, so those with hypotension should monitor their response. Bleeding disorders or those on blood thinners. Saffron may increase the risk of bleeding, and this effect can be additive with blood thinners. When taken alongside medications like warfarin, aspirin, or clopidogrel, saffron can increase the risk of excessive bleeding by enhancing the effects of these drugs. This interaction can lead to complications such as easy bruising, nosebleeds, or internal bleeding, making it important for individuals on blood thinners to avoid saffron or consult a healthcare provider before using it. Saffron may interact with antidepressants. Combining saffron with other mood-regulating medications can increase the risk of serotonin syndrome, a rare but potentially life-threatening condition that occurs when there is too much serotonin in the brain. That's why it's essential to talk to a healthcare provider before combining saffron with existing treatments. Saffron may not replace antidepressants for everyone, but it holds real promise as a complementary or alternative option, especially for those experiencing mild to moderate symptoms or intolerable side effects from traditional meds. However, while the research is encouraging, it's critical not to stop or change any prescribed medication without first consulting a licensed healthcare professional. Natural remedies can be supportive, but they should always be part of an informed, guided treatment plan. What do you think about using natural remedies like saffron for mental health? Drop your thoughts or experiences in the comments. Thank you for watching. Please take a moment to like, share, and subscribe. Check out our other videos and keep your body in balance with the Balanced Body Project.